This talk, we're calling it Lessons from the ER, but it's really lessons for life. And when we host our show, I think sometimes people forget that I'm an ER doctor. At my heart and soul, that's who I am. That's where my perspective comes from. And for me, oftentimes it's too late. People come in and see me, and all I can do is offer a Band-Aid. So early in this talk, we're going to talk about a few scary things. But the whole point of myself being up here is not to scare anyone.
No.
It's to make everyone aware, to empower you, to make the best possible choices, both before tragedy potentially hits, but also potentially after. Well, it's interesting, in the ER, you don't see what happens in the kitchen or the living room or the bedroom. You see one of two stories. And I don't want to be dramatic, but I said early on I might make you more aware. I wish we had come sooner, which you never want to hear. Mm-hmm. Or, I don't even know if I need to be here. And I would rather hear, I don't know if I even need to be here, than I wish. Because when you're in the ER and you say, I wish, it means you did something that you wish you didn't do. The lesson from the ER here is better safe than sorry. You can do everything in life right. Mm-hmm. You can do everything perfectly, and yet illness can still befall you. With women in particular, the symptoms can be very confusing. Mm-hmm. One woman's heart attack is not another woman's heart attack. One man's heart attack is not another man's or another woman's. They're all very individualized. And so if there's a lesson beyond better safe than sorry, the symptoms of a heart attack can literally range from chest pain or chest pressure, with or without shortness of breath. You may or may not have, we often call it cold sweats, or you may be sweating. You may feel some nausea, or you may not. You could feel some left arm or right arm heaviness, pain. And that's where I want everyone to think tonight when you go home. Look in the mirror, take stock of yourself. Know what your baseline is. If you're someone who's always healthy, and now all of a sudden, every time you carry the groceries from the garage to the kitchen, you're short of breath and there's just a little bit of heaviness in your chest and you're just fatigued all the time. There's no fever. You don't have the flu. So why are you feeling fatigued? Well, that's a red flag. You really should, if you're someone who's on any prescription medication or any supplement, carry a list with you of your medications, the dosages. If you've taken an antibiotic within the last number of months, write down what that antibiotic was, how long the course was, what the dose was. So when you show up in the emergency department, immediately when you share that with us, I can provide you such better care, because I always say the best patient and doctor interaction is one where we work together. Lessons from the ER really is, it gets back to the number one killer, which is heart disease. The reason it's important not to ignore a heart attack, it's twofold. Number one, during a heart attack, blood flow is being blocked to your heart muscle, and depending upon how much blood flow is being stopped, that tissue, that heart muscle literally dies. So the more time you're debating whether or not, while you're having chest pain or shortness of breath, weakness, the more time you delay, the more of that heart muscle is dying. Over time, if you've had a heart attack and haven't addressed it, your heart becomes less efficient. But the one thing I worry about as a doctor, and the reason why if you come in with these symptoms, we hook you up to a monitor, it's because the one thing that no one ever wants is something we call sudden cardiac death. It can happen in an instant. You can be fine one moment, and until, I don't know if any of you have ever witnessed it, but in the emergency department, it happens all too often, where someone is experiencing a heart attack, they come in, and if no one recognizes right away what's going on, it can literally be a heart attack 1 minute and then a cardiac arrest the very next. We have so much control over how well and how long we live. Prevention is obviously the best thing, right? Because there's not some universal wonderful screening test when you hit age 40. If you are doing all the right things, not smoking, watching your weight, watching your cholesterol, blood glucose, blood pressure, doing all those things, you're doing the best job you can. And this message, the reason it resonates so much for me is, and I live my life this way because By reducing my risk for heart disease, the number one killer, I know that in hand I'm reducing my risk for all the other chronic illnesses that befall us. Maybe my last lesson, it's that one. Let's combat the number one killer of women, and in so doing, we'll also combat a lot of these other chronic illnesses.